I'm Tom Terranova, CEO of Quad A. Thank you for joining me today on this video made in conjunction with AAPD about building patient confidence in your practice. If you haven't already, please check out the other videos in this series that we've made related to patient safety and accreditation, and particularly this joint effort between the two organizations. I've been with Quad A since 2009 and specifically working on patient safety related to pediatric dentistry since 2016 at the request of AAPD. Today, I'm going to speak to you about enhancing safety for our little patients and building patient confidence in your practices. And if you have had a chance to view my presentation on responsibly marketing your practice, this session takes a deeper dive into the data that we uncovered to drive the recommendations in that talk. If you haven't seen that session, be sure to check it out because it builds on all that we learned here in this session. As you'll see in this talk, recent research indicates that patients have several key concerns in the back of their minds as they consider whether and where to have their children undergo procedures. These concerns create an underlying lack of trust in outpatient centers, like the ones that many of you run. Over the next few minutes, we'll discuss the operational areas on which you can focus and which you can communicate to your patients to increase confidence in your center. First, a bit of background about Quad A for those of you who may not be especially familiar with us. We were founded in 1980 as a nonprofit, patient safety-focused organization to provide accreditation services back then in plastic surgery. Since then, the specialties that we accredit, the provider types, and the care environments that we accredit have diversified greatly across the country and really around the world. Today, we accredit nearly 4,000 locations in 14 countries, and at one time or another have worked in 20 countries. Quad A is distinguished by its peer-based program and educational approach, and specifically by our 100% compliance mandate. We feel it's incredibly important, especially in small and medium-sized practices, to have a 100% compliance mandate and not leave facilities and their patients with 80 or 90% compliance and some advisory notes. We also have a unique data reporting system that requires every practitioner around the world to provide data on random cases and all their unanticipated events. This allows us to partner with research partners at universities and academics around the country to really glean out on a population level the risks and opportunities to enhance safety for patients in all care environments. A third distinguishing factor in the Quad A program is board certification and specialty training. We require that every practitioner in every center have the highest level of training, residency, fellowship, etc. in their specialty, and that those services that they provide in their centers are limited only to what they are trained for. It's incredibly important because in our care environment, especially in small facilities and medium-sized facilities, practitioners can take a weekend course or can develop a certain number of expertise in a service and start to offer that service. And maybe they are not as well qualified as you in providing that bit of care safely and to have the appropriate knowledge to respond to any emergencies that may arise. Finally, we have a requirement that is quite unique in accreditation and in regulation that I know of around the world, and that is that we require the evidence of corrective action to be submitted by every facility before we confer accreditation. Everybody working in a small or medium-sized environment knows how easy it is to have a meeting, to develop a great plan of action, and then to get really busy and not follow through on it. It happens to every one of us, including at Quad A. What's really important, though, is that we partner with the facilities to provide a consultative approach to achieve correction, and we collect the evidence of corrective action so that each facility is set up to succeed long-term with a solid base and foundation to move forward so that they'll maintain compliance on an ongoing basis. As I said before, Quad A undertook this endeavor at the invitation of AAPD back in 2016. I remember having the very first meetings with AAPD about the risks and the high attention media events that were happening whenever there was a patient safety concern or an unfortunate adverse event. All of this has leveraged our 40 years of experience doing accreditation, 20 years of accreditation experience outside the US, and our expertise that we've gleaned working with AAPD to create this program to allow us to more specifically address the needs and concerns of pediatric dentists providing sedation dentistry and specifically your patients. The negative impact of the rash of high-profile adverse events that occurred in practices providing pediatric dentistry provide those services is a huge detriment to your specialty. And this program is a huge credit to the leadership of AAPD and your specialty to address that issue, to address patient concerns, and to make sure that patients are always receiving the best possible care and that they know the difference between an AAPD accredited practitioner and center and those who might not carry the same diligence in how they go about their daily business. There's an inherent value attached to patient safety. No parent wants their child to wind up as a cautionary tale. Deep down, they want to make sure that if they choose to have them undergo a dental procedure under sedation, it won't cost the child their life. There are more concerns, of course, but many of these concerns, articulated and unarticulated, come back to the psychological and emotional need of the patient and their parents and their concern for their own safety. We all know the moral obligation to avoid tragedies, but there are practical benefits to following the best practices in key areas and to communicating honestly and proactively with the parents of your patients about the best practices that you employ to ensure that the children are safe. This will improve the parents' view of your center and provide them with additional confidence to choose your center, promote you, and to refer others to your care. For those of you who don't know, Quad A's origins are with plastic surgery. Our organization was born of the need for plastic surgeons in the 1980s to establish an impartial third-party quality and safety assessment to insulate the specialty from negative events. The dynamics in plastic surgery and pediatric dentistry are shockingly similar. By way of background, I want to share this slide, which was part of the very first presentation I gave to the AAPD board in 2016 and 17. Each story is a high-profile event and create an enormous amount of pressure on the specialty, even though many of the people performing these procedures and these services may not be members of the society, may not be your colleagues, and may not have the same training that you have. Each case can skew the perception of pediatric dental care to suggest that complications are more common than they really are, and the emotions of the story obscure important details, like the type of practitioner involved, their training, their education, their ethics. Because of this specialization required to be a pediatric dentist and to provide pediatric anesthesia safely, it's important to understand what resonates and increases patient confidence, and specifically in your case, parent confidence. Pediatric dentistry is a similar situation to plastic surgery because of the tendency of people outside of the specialty to perform cases within the specialty, to do the services that you provide, even though they might not be as trained as you are. When there's an adverse outcome in plastic surgery, the patient is usually relatively young, relatively healthy, and therefore the loss of life or the loss of functionality in life is incredibly traumatic and makes for a very interesting media story. This is exacerbated tenfold in pediatric dentistry because your patients are the most vulnerable. They're the most vital. They're the youngest and healthiest of us, and it makes every loss of life and functionality that much more tragic. For that reason, there's the same sensationalist media approach and the same risk factors that you have to consider that we navigated with our plastic surgery clients in the 1980s. It's incredibly important to remember this analog, as your specialty is very different, but a lot of the dynamics are the same. First impressions are important. We all know this. It's why you want to look professional when you meet your patients. It's why you want to have a professional appearance in your facility, and it's why you want to have a professional web presence. But we have to remember that this isn't actually the first impression. In fact, patients start to think about the services that they'll select long before they actually choose a provider. One of the shortcomings, I think, in the medical community is our dialogue with patients and our dialogue with the public in general. I've long felt that accreditation, healthcare, dental care, all of the specialty societies don't always communicate with patients on a peer-to-peer eye level. About 2 or 3 years ago, Quad A commissioned blind studies to be conducted by marketing research firms to understand patient decision-making in seeking care and choosing providers. The first, and I think most important finding of this group across all specialties, across all geographic locations, and across all segments of the population, and across all types of care that they're looking for, was that patients are more skeptical of the non-hospital setting than they are of the hospital. Specifically, 35% of patients and their parents, in the case of pediatric patients, will not even entertain the idea of undergoing elective procedures in a non-hospital setting. If you talk to your patients, you may be misled by selection bias that patients don't necessarily want to go to the hospital. I would caution every practitioner against that, because when you talk to your patients, you're already picking people who've selected you, and they have their own reason for doing that. They might be part of the 65% of the population that is willing to select elective care in a non-hospital setting. If 35% of patients are not likely to select care in a non-hospital setting, that means they may be going to a hospital. It also means they may forego care entirely. And in the case of pediatric patients, if the parents are scared off by what they think is a risky environment, they may not select to have their children undergo pretty necessary care because it is technically elective. The first caution I want to tell you about this data, just to be transparent, is that we went across all provider types, as I said. So this includes both medical care and dental care in this data. Importantly, when we dug deep, we realized that there was no statistical difference between those parents of patients aged 2 to 10 who were seeking dental care and the broader patient population. So there's really no reason to parse out the differences between dentistry and medicine here. The patient profile is essentially the same. If we dig deeper, we uncover the thoughts that erode patients' confidence in clinics and centers. Reviewing this list can tell you what areas to focus your efforts and your patient education on in order to build confidence in your center among not only existing patients, but that patient population that currently won't even entertain the idea of coming to a non-hospital setting. 34% of patients, and in your case parents, do not believe that centers and clinics are appropriately equipped to respond to emergencies. Emergencies here are broadly defined, including natural disasters such as flooding, human-induced disasters like fires or intruders, medical emergencies like a patient arrest, and even emergencies related to the center's staff. For example, what happens if the anesthesia provider has a medical emergency? What happens if the dentist passes out for some reason? And therefore, by spending time to develop your planning, your equipment, your relevant procedures for relevant emergencies, and then taking the time to educate your parents about all the steps that you may already do or that you need to do and that your staff undertakes to be ready for these emergencies, you can improve the confidence of 1/3 of all patients in your center. Similarly, if you bolster your infection control practices and take time to educate the patients about your infection control preventative measures that you have in place, you can improve the confidence of almost 30% of patients in your center. Let your patients know about your center. Let them know that it's not just cobbled together to do the best you can in a physician's office, because that's very often the concern that they have. Let them know that you're fully equipped to mitigate the risks that their children are likely to see in a sedation case, and that you can respond if, for some reason, the risks of surgery or the risks of a procedure under anesthesia or sedation actually happen. Talk about your hospital affiliations. Patients really do care about this. If you have a connection to a children's hospital, this is quite powerful. I'm sure you all talk about your training and certifications. It's incredibly important, but there's more to this as well. Proactively talk about the safety of your center. Any walkthroughs or other routine checks that you perform on the building, the equipment, your emergency infrastructure like your fire alarms and extinguishers, your own internal quality improvement initiatives, if you do surveys and studies of your teams. Much of this can be done without fear-mongering and is probably second nature to much of your team. Certainly, it is required by accreditation, and if you go through the accreditation process that Quad A and AAPD have devised, you will be doing this as part of your compliance. But patients are not always aware of all of the money, effort, and time that you put into your safety measures. So communicate them to your patients. Have a return on your investment of time and human resources. Each of these factors listed was important to about 1 in 5 patients. How much would your center benefit by improving the confidence of 1 in 5 patients? If you look at this slide here, you can understand that in our study, the researchers provided patients with really basic information about compliance, about patient safety, and about accreditation. They used the idea of a hypothetical center and talked about the patient's baseline trust in the facility, their perceptions of quality of care and of safety, and then provided this education and then measured the differences in their perceptions. Accreditation was easily a single piece of information that patients could digest and that had a massive increase in their perceptions across all measures. After receiving the most basic education addressing each of their concerns that we talked about on the previous slide, 79% of patients saw a center or a clinic as being more trustworthy. 40% of the patients saw the center as simply more trustworthy, but 38% of patients considered the center to be much more trustworthy. So there was a differentiation. Some people saw it as slightly better, some people saw it as much, much better. But all in all, the improvement across 80% of patients was that the center gained more trust. 82% of patients considered the center to be providing high quality care after receiving just this basic information. If you recall from the previous slide, nearly 20% of patients just broadly thought that centers provided a low quality of care generally. So we've sort of started to change the mind of 82% of patients just based on basic little information that talks about the measures that you go through to improve your safety and to improve your quality of care. Further, 80% of patients indicated that the educational content made them more confident in the safety of the facilities and that the chances of an emergency occurring became lower once they learned about accreditation. Similarly, 81% of patients said that the patient education made them more positive or much more positive about the center's ability to respond to various types of emergencies. Remember, the number one patient concern, over 1/3 of patients or parents who are making the decisions for their children were concerned that an outpatient setting could not respond adequately to an emergency. So 81% of patients are having their number one concern addressed simply by knowing that you have an emergency response plan in the works and that you're equipped to handle any emergency that might arise. Finally, from this statistics here, 79% of patients said that the messaging improved their perception of the center's ability to provide considerate and compassionate care. Simply put, they know that you care. They know that you are looking out for their children's best interests. Initially, patients seemed to have an unarticulated fear that the center would provide care that's less personal and less compassionate. But messaging about your safety, your quality, your preventative care really changed all of that. If any advertising agency, PR consultant, or marketing firm ever offered to increase your metrics to an extent like this, I'm willing to bet that most of you would have your pen ready to sign the engagement letter. This is improvement that targeted patient education has been shown to have on patient confidence in centers just like yours. In the previous slide, we examined what percentage of patients felt that patient education improved their confidence in various metrics in a center. In this slide and in this exercise, the researchers attempted to quantify how much the patient education had an impact on those 80% of patients who saw an increase. It's really important to know if that increase was slight or whether it was dramatic. The researchers conducted what's called a max diff study to understand the difference each message might have in the overall perception of a facility. Just to get into a little bit of detail so you can contextualize this, when conducting a max diff study, the baseline perception of the messaging is 100. And we gauge the impact based on the deviation of the scoring up or down from 100, meaning a message may diminish their perception of your facility or increase their perception of your facility. In this case, information about the quality of all of the practitioners and all of the parts of your team had the single greatest impact on your patient's perception of your facility. So when we talk about the 80% of people that thought that you were more trustworthy, provided more compassionate care, the message that did that the most was talking about the training of all of your staff, nurses, anesthesia providers, even administrative staff. While the dentist is a really central part of the map and of the puzzle, remember that the dentist is a part of a broader organism. And so the messaging that 14% improvement in trust and in the perception of the quality of care was from understanding that the dentist had appropriate training and specialization. 20% increase was realized when the patient was educated that all members of the staff underwent training, appraisal, further review, and was ensured to be part of a high-quality team. The team is more important than any single part. As you can see from the slide, there are other messaging and measures that lead the patient to have more confidence in your center. You can obviously see them and read them. These are all critical components and important parts that you may already be doing, you may already partly be doing, and are all certainly part of the accreditation program that we have worked with AAPD to build. So the messaging here is that we can find out patients' fears, find out how to address them, communicate to them very specifically, and alleviate a lot of those concerns in a way that impacts 80% or more patients in a really dramatic way. Finally, and the good news is that patients told us exactly how they want to hear this good information, this education, and all of these pieces of data. I'm not going to go into detail here because we talk about it in some detail in some of the other talks, and you all can read through this slide. But what you can see here is that we asked patients directly, what's the best way to deliver all of this information? And the patients told us not only a good way to reach them, but in many cases the best way to reach them, how they want to see the information about your safety, about your quality initiatives, and about the care you take to ensure their child's safety. If you can deliver the messages that we've talked about in the methods that the patients have asked you to, you can increase the patient's confidence in your center so much that there's a really good chance that we can change those 35% of skeptics who would never go to a non-hospital setting for elective care into people who may consider your care, and would also go a long way toward winning patients that may find themselves in other centers that are not regulated and can't demonstrate the kind of quality, safety, and concern that you can. I'd like to thank you for your attention, both in this talk and hopefully in the others that we've conducted. I want to thank you for being part of AAPD and working with Quad A to provide a patient safety initiative like this. It really is a testament to your specialty that you have voluntarily undertaken this initiative, and I hope that we'll see a lot more of the members come on board with accreditation and really with initiatives internally to become the safest practice you can be. I know a lot of you care deeply, and it's really easy to get caught up and in the day-to-day grind to understand that there are methods and third-party arm's length assessments that can help you assure that you're doing things safely so that it doesn't get lost in the shuffle of the day-to-day practice. If you have any questions about accreditation or simply about making your practice safer, I encourage you to contact our office via our contact information here or the AAPD leadership who can put you in contact with us as well. Thank you again for all of your time.